today. Well, young adult survivors of cancer look forward to long-term survival due to improved treatments. But the truth is, some side effects may cause infertility. Dr. Jeremy Groll from SpringCreek Fertility is here with more on the new reproductive technologies to help preserve fertility in cancer survivors. Welcome.
Oh, thank you, Katie.
This is a big topic because, you know, a while ago, people really didn't have a lot of options. Things are changing.
That's correct. And actually, just saw some statistics where now estimated over 90% of cancers are currently considered treatable.
Wow.
And so we have people living longer and longer lifespans after a diagnosis of cancer.
Sure.
And giving them then the potential for building their families and having future, family plans and, reproductive options.
Yeah.
And so now we've got, of course, means for preservation. So with men with a diagnosis, we can certainly have them store samples, but we can now also do that with women, and that we can store eggs. And so certainly as we look in terms of when someone faces a diagnosis of cancer, of course the timeline is fairly tight, but if we have people who are known to be at risk, certainly if they should happen to have like a cancer risk gene like the BRCA genes, which in the old days we used to have big family trees with many family members who may have had those cancers. Now we kind of have more family taproots, and so even one or two primary relatives that have a cancer like breast or ovarian before the onset of menopause may be at risk for having one of these gene mutations. So certainly anybody with concern about that should check with their doctor and see what can be done to screen. And then once we do also have a diagnosis of cancer, we now have support from the Livestrong Foundation, which has financial support and assistance for people to go through their fertility treatments and be able to have the opportunities for those treatments, because those treatments can have a direct effect on the quality of the sperm or eggs and some of the potential for having their families in the future.
Sure. Talking about some side effects, you have a list of side effects when these issues happen: ovarian damage, early menopause. Talk about these for a moment.
Well, in that when we look at, say, chemotherapy or with radiation therapy, we looked at some of the older data would show higher rates of early onset of menopause, and there are means that we can do to kind of suppress the ovaries to keep that from happening. But now with our current ovarian testing, and one test in particular called AMH, which is kind of like an egg counter, that we can see damage that might not mean full menopause, but could have implications on their fertility potential. So using markers like that can help us gauge how quickly they may want to pursue treatment or gauge their family plans.
Sure. We're almost out of time, but some of the issues with men as well. Here's a couple of them up on your screen. Basically damaging to the testes and sperm production.
Sure, and not only that, but also nerve damage, so that may have actual sexual function that may be impaired.
Sure.
So beyond even just, say, the hormonal aspect, but there's always, various options for ways that we can, potentially give them their best chance for the family.
Excellent. For those options, if you want to find out more information, you can visit them there on Clio Road in Centerville, or of course, SpringCreekFertility.com. Dr. Groll, thanks so much for being here.
Thanks, Kate.